Hello, my dear friends, and a very warm welcome back to Elderflowerings. It is always a profound joy to gather with you in this shared space, a community dedicated to exploring the multifaceted journey of aging with dignity, curiosity, open hearts, and a proactive spirit towards achieving and maintaining our most vibrant well-being. Today, we are venturing into a subject that is vital for men's health, particularly as they navigate their 60s, 70s, 80s, and the rich years beyond. It's a topic often surrounded by a surprising amount of societal silence, perhaps some discomfort, or even outdated misinformation, yet it holds significant implications for daily comfort, for long-term health, and for the overall quality of life that every man deserves. The specific question we are thoughtfully and respectfully considering today is this: does daily masturbation affect your prostate health, especially for older men? It's a very direct question, and one that many men might ponder privately but hesitate to ask openly. In a society that has often relegated discussions of sexual health, particularly self-intimacy in later life, to the shadows, it's understandable why clarity might be lacking. Here at Elderflowerings, we believe in shedding gentle, respectful light on all aspects of healthy aging. Our aim today is not to prescribe a rigid regimen, but to explore what current understanding from medical research and clinical observation suggests about the relationship between regular ejaculation, which can include potentially daily self-stimulation, and the well-being of the prostate gland. We'll also touch upon how this very personal practice might connect to broader aspects of a man's vitality. This is about empowering you with knowledge, dispelling myths, and encouraging a proactive, informed approach to your own body and health. It's about understanding how your body is designed to function and how you can support its natural processes. So, if you are a man seeking to understand more about this aspect of your well-being, I warmly invite you to join me for this important, candid, and respectful exploration. Before we begin, if this kind of in-depth, compassionate, and health-focused guidance is something you value, please do take a brief moment to like this video. If you are new to our community, we warmly invite you to subscribe to Elderflowerings and tap that notification bell. And as always, your respectful thoughts are welcome in the comments below. Now, let us begin. A moment of reflection. Self-care, not shame. Before we delve into the first of our 7 insights, it's essential to create a space of understanding. For many men, especially those from older generations, the subject of masturbation may have been surrounded by silence or messages of shame. Let me be clear. From a modern understanding of human physiology and holistic health, self-intimacy, when practiced by a consenting adult in a way that feels right, is a normal, natural human expression. Today, we focus on its role as a form of profound self-care and a contributor to physical and emotional health maintenance, particularly for men as they age. This conversation is offered in that spirit of gentle liberation and informed self-care. Insight 1. Supporting your prostate and urinary wellness through nature's design. The first vital insight concerns the health of the prostate gland. Many men wish they'd known earlier how regular, healthy ejaculation, including through masturbation, acts as a natural and supportive mechanism for maintaining prostate and urinary wellness. The prostate, a walnut-sized gland below the bladder, produces seminal fluid. As men age, benign prostatic hyperplasia, a non-cancerous enlargement, is common, affecting about half of men by 60 and up to 90% by 85. BPH isn't cancer, but it can cause bothersome urinary symptoms by squeezing the urethra. frequent or urgent urination, especially at night, weak stream, difficulty starting, or a feeling of incomplete emptying. While these changes are common, they aren't something to just endure. The prostate benefits from regular flushing. When ejaculation is infrequent, seminal fluid can stagnate, potentially creating an environment for inflammation and congestion, which can exacerbate BPH symptoms. Ejaculation expels older fluid and cellular debris, a natural cleansing mechanism. Consider Arthur, 78, who suffered from disruptive BPH symptoms. He'd ceased sexual activity years ago. When we discussed how the prostate benefits from regular emptying, it was a revelation to him. While not a cure for his established BPH, he found that reintroducing regular self-stimulation alongside medical management brought him greater comfort. Research supports this. A landmark Harvard study following nearly 30,000 men found that those with higher ejaculation frequency, 21 plus times a month, had a significantly lower risk of prostate cancer compared to those with very infrequent ejaculation, 4 to 7 times monthly. The prostate stagnation hypothesis suggests regular flushing may clear potentially harmful substances. This isn't about performance, it's about function and prevention. Honoring this natural process supports your prostate's long-term health. It's knowledge many men appreciate when learned in time to make a difference. Insight 2. Nourishing mental clarity and your cognitive spark. Our second insight often surprises men. Regular self-intimacy leading to orgasm can act as a natural cognitive nourisher, helping to support mental clarity, focus, and memory, while its prolonged absence might subtly contribute to brain fog. David, a retired engineer of 70, shared his concern about increasing forgetfulness and feeling mentally foggy. While some cognitive changes are normal with age, the neurochemical events during orgasm play a supportive role in brain health. Your brain releases beneficial substances: dopamine, focus, motivation, serotonin, mood, cognitive flexibility, and oxytocin, stress reduction, calm. These aren't just fleeting pleasures. They support neural health, stimulate blood flow to the brain, and reduce levels of cortisol, the stress hormone detrimental to brain cells, especially the memory-critical hippocampus. When regular sexual release ceases, the brain experiences fewer of these protective neurochemical surges. This can contribute to mental dullness or difficulty concentrating. For men, testosterone, linked to cognitive functions like memory and processing speed, can also decline more rapidly when all sexual activity stops. Research suggests regular ejaculation can support more optimal testosterone levels. While not a cure for serious conditions like Alzheimer's, self-intimacy is a piece of a holistic approach to brain health. It provides natural, positive neurological stimulation. When David understood this, he felt a renewed sense of agency. Many men wish they'd understood this brain-body connection earlier. The link between physical experience and mental acuity is profound. Nurturing one aspect can directly benefit another. It's powerful self-care. Insight 3. Cultivating emotional balance and resilience against low mood. Our third vital insight touches the core of daily experience. Continued self-intimacy serves as a natural mood regulator and stress reliever. Its absence can leave older men more vulnerable to low moods, irritability, and even depression. Frank, a 72-year-old widower, felt emotionally flat. He'd lost joy and found everything irritating. He'd closed the chapter on sexual expression after his wife passed. What Frank didn't realize is that orgasm triggers endorphins, natural mood elevators, and oxytocin, promotes calm, reduces anxiety. This is nature's built-in antidepressant. When this release is absent, especially during times of stress like loneliness or grief, emotional equilibrium can be disrupted. Chronic stress keeps cortisol high, contributing to tension and negativity. This flatness can evolve into depression, which in older men often manifests as apathy, loss of interest, fatigue, or irritability, rather than overt sadness. Many misattribute these changes solely to old age. When I discussed this link with Frank, he was initially dismissive. But understanding it as overall well-being, he reconnected with this aspect of his physicality. Months later, his daughter reported a cloud had lifted. Frank felt less burdened and more like my old self. Self-intimacy is not just physical, it's psychophysiological. It's about your body's capacity to self-soothe and generate well-being. To neglect this, especially when other joys diminish, is a sacrifice with an emotional cost many men realize too late. Insight 4. Inviting deeper, more consistently restorative sleep. This fourth insight addresses a cornerstone of health, restorative sleep. Regular orgasm can be one of nature's most effective, yet often forgotten, aids to achieving it. Mr. Peterson, from our prostate discussion, also had fragmented sleep, waking at 2 or 3 a.m., mind racing. His urological issues improved, but poor sleep persisted. He too thought this part of his life was over. Orgasm triggers a potent hormonal cocktail ideal for sleep. Oxytocin and prolactin associated with sleepiness surge, while cortisol, stress/alertness hormone, drops. Breathing slows, heart rate steadies, muscles relax, the perfect physiological state for deep sleep. When older men cease self-intimacy, they lose this natural sleep-promoting tool. Restlessness and frustration often fill the void. Some turn to sleep aids, risking side effects and dependency. Others resign themselves to chronic exhaustion. Poor sleep in seniors is serious. It weakens immunity, accelerates cognitive decline, raises cardiovascular risk, and increases vulnerability to anxiety and depression. It also contributes to falls and loss of independence. Many patients withdraw not from illness, but from sheer exhaustion, unaware they might be missing a natural key to better sleep. Masturbation leading to orgasm can be the difference between fragmented tossing and turning and deep healing rest. One patient, after resuming self-intimacy, said, "I sleep like I did 30 years ago. I didn't realize how much I needed that release." Too many men mistake physiological neglect for inevitable aging. If you struggle with sleep, consider if your body is missing this natural rhythm it still remembers. This connection between release and rest is deeply physiological. It's another way our bodies are designed for holistic well-being. Insight 5. Maintaining pelvic strength and vital circulation. Our fifth insight focuses on the very foundation of male physical integrity. Regular self-intimacy, through the mechanics of arousal and orgasm, naturally exercises and supports the health of pelvic floor muscles and promotes vital circulation in the pelvic region. Mr. Harrison, our retired firefighter in his mid-70s, felt his foundation giving out, mild urinary leakage and discomfort when standing. This often points to weakening pelvic floor muscles. These muscles support your bladder, bowel, and sexual organs. Most don't think about them until problems arise: leakage, constipation, erectile dysfunction, or pelvic pain. Regular sexual stimulation leading to orgasm causes rhythmic contractions of the pelvic floor. This is a natural workout, crucial for function, not vanity. It improves blood flow, strengthens internal supports, and keeps nerves and muscles responsive. When this regular exercise stops, these muscles can weaken and atrophy. Blood flow can diminish. Tissues become less elastic. Symptoms you never anticipated may appear. Many older adults avoid outings due to bladder uncertainty, a loss of dignity no one deserves. This often traces back to neglecting pelvic region activity. While specific Kegel exercises are beneficial, the natural contractions during orgasm provide a holistic way to engage these muscles. Reclaiming this connection isn't just about pleasure. It's about restoring strength, sending blood where it's needed, waking up nerves, and keeping tissues vital. It's about supporting your body's core integrity. Insight 6. Bolstering your natural immune defenses. This sixth insight is one that often surprises people. Regular sexual activity, including masturbation, can provide a natural and supportive boost to your immune system. Mr. Davies, usually robust in his late 60s, found himself battling recurrent colds and infections. He felt his body wasn't fighting like it used to. He too had long retired from any form of sexual activity. What many don't realize is that during sexual arousal and orgasm, the body produces immune-enhancing agents. For example, levels of immunoglobulin A, a key antibody defending mucous membranes in your respiratory and digestive tracts against pathogens, have been shown to rise following orgasm. Endorphins released also have anti-inflammatory properties. Furthermore, the stress reduction associated with sexual release is crucial. Chronic stress, high cortisol, suppresses immune function. By helping to regulate stress hormones, regular self-intimacy can indirectly support a more resilient immune response. At a life stage where immunity might naturally become less efficient, immunosenescence, losing this natural support mechanism can leave one more vulnerable. When Mr. Davies, understanding this connection, chose to respectfully re-engage with this aspect of his self-care, he later reported not just feeling more alive, but also experiencing a winter with notably fewer illnesses. This isn't magic, it's physiology. Your immune system responds to these positive inputs. This practice is one way to send a message of vitality throughout your entire system. Insight 7. Affirming self-connection, body ownership, and enduring self-worth. Our final insight is perhaps the most subtle, yet arguably the most profound. Regular, mindful self-intimacy is a powerful act of affirming your connection to your own body, maintaining a sense of body ownership, and nurturing your enduring self-worth as you age. Arthur, a retired principal in his late 70s, once shared, "Dr. Kara, I don't really feel like I live in this body anymore. I feel like I'm just inhabiting it." This heartbreaking sense of disconnection is not uncommon. Often, it can begin or be exacerbated when men cease all forms of intimate self-touch, believing it's no longer relevant or appropriate. But self-intimacy isn't just about physical release, it's about presence. When you touch your body with intention and care, you send affirming messages to your nervous system. I am still here. My body matters. I am connected to my physical self. Without this, a psychological distance can form. It can become easier to ignore your body, to feel alienated from its changes, to believe this chapter isn't worth the same nurturing. This can erode self-worth. Reclaiming your body through self-touch isn't about trying to be young again. It's about honoring the life within you now. It's saying, I am still here. I still feel. I still deserve to feel connected and at home in my own skin. This act of self-acknowledgement can counteract feelings of invisibility or diminishing value. It's a way to come home to yourself, affirming that aging is not vanishing. This, perhaps, is the most healing act of all. Navigating challenges and listening to your body's wisdom with compassion. As we embrace these insights, it's vital to acknowledge that for many older men, there can be real and understandable hurdles to maintaining or re-engaging with self-intimacy. These are not failures, but common life challenges. Physical limitations like arthritis or chronic pain, changes in libido or erectile function due to health conditions or medications, emotional factors like grief or past beliefs, or lack of privacy can all play a role. The key is gentle problem solving and self-compassion. For physical limits, explore comfortable positions or adaptive aids. For libido/erectile concerns, please talk to your doctor. Many causes are treatable. Don't assume it's just age. For emotional factors, reframing self-intimacy as vital self-care can be liberating. The guiding principle is your comfort and well-being. This should not be a source of stress. Crucially, maintain open communication with your healthcare provider about all aspects of your health, including prostate and sexual well-being. They can offer personalized advice and rule out underlying conditions. Your health, your informed choice, your enduring well-being. As we conclude, I hope this discussion has illuminated how regular self-intimacy, potentially daily for some if comfortable, can be a significant, natural, and supportive practice for men's prostate health and holistic well-being as they age. The secrets we've unveiled are really about your body's innate wisdom and its capacity for self-care. The choice is always deeply personal. My aim has been to empower you with knowledge, to help dispel outdated stigmas, and to encourage you to view this natural function as a valid and valuable tool for health maintenance. Your vitality, your comfort, your quality of life, these are what truly matter, and you hold so much power through informed choices to nurture them. Thank you for joining me on Elderflowerings for this candid exploration. Your willingness to engage with these topics is so valued. I'd love to hear your respectful thoughts or questions in the comments. If this video has been informative, please like it, subscribe for more content on thriving as we age, and perhaps share it. Until next time, take wonderful care of yourselves, listen to your body's wisdom, and remember that every day is an opportunity to choose health. Be well.